All right, let's just cut right to the chase today. We are taking a hard, completely unflinching look at a systemic failure that quite literally affects every single one of us. We're talking about the current state of American healthcare. Look, whether you're a frustrated patient sick of the bills, a burned-out physician ready to quit, or a forward-thinking technologist, you are going to want to pay very close attention to this explainer. Because we aren't here to talk about minor tweaks or little policy patches. No, we are here to talk about a fundamental teardown and total replacement of the medical-industrial complex.
If we had to sum up the verdict on this whole system, it boils down to one absolutely brutal, visceral statement from our source material. American healthcare is a crime scene. And you know what? That is not hyperbole. It is a calculated, empirical assessment of an industry that has fundamentally failed its citizens and just entirely lost sight of its core mission.
I mean, the sheer scale of the dysfunction is just staggering. $5 trillion. Let that number sink in for a second. That is what the United States spends annually on healthcare, literally 1/5 of the entire American economy. And for that astronomical price tag, we inexplicably trail Europe by 6 full years in life expectancy. We are spending exponentially more, but we are living significantly shorter lives. Make it make sense, right?
Economically speaking, you were essentially paying Mercedes prices for a fundamentally broken bicycle. Over the last 30 years, nearly every single dollar of real wage growth for the American worker has just vanished. It's been swallowed up by rising healthcare premiums and what our source material perfectly describes as billing theater. You're paying top-tier, luxury prices, but you're receiving fragmented, rushed, and often completely broken care in return.
Now this brings us to a terrifying truth that shatters a really common myth. We constantly hear people say the healthcare system is broken. Actually, scratch that. The data suggests something entirely different. The system is performing exactly as designed. It hasn't been optimized for your health or for clinical outcomes. It has been meticulously optimized for revenue extraction. The machinery of modern healthcare is working flawlessly if the goal is to maximize billing, but it is failing catastrophically if the goal is human vitality.
So what does that revenue extraction actually look like in practice? Well, get this, an estimated 30% of all U.S. healthcare spending is considered completely wasteful or low-value care. When you're dealing with a $5 trillion industry, 30% isn't just a rounding error. It is a staggering drain of resources that should be going toward preventative care, actual healing, and, lowering the financial burden on everyday patients.
Let's isolate a $2.5 trillion chunk of that complex and think about where the money is actually being siphoned off. $1,305 billion is just swallowed up by hospitals and the care system infrastructure. Another $950 billion goes directly into the pockets of the insurance industry, and $297 billion straight to pharmaceuticals. This is the medical industrial complex in action, folks, trapping patients as mere profit centers for these massive corporate pillars.
But hey, patients aren't the only victims here. Let's shift our focus to the providers for a minute. We have these highly trained, absolutely brilliant physicians who spent decades mastering the human body, only to be reduced to glorified data entry clerks. Legacy electronic health records have fundamentally altered the practice of medicine. Instead of actually looking at you, their patient, doctors are forced to stare at glowing screens, navigating compliance theater, and just endlessly clicking drop-down menus to satisfy corporate billing requirements.
Let's drill down into a very specific, painful reality of this system. 32 minutes. That is the average time allocated for a primary care encounter today. And keep in mind, that 32 minutes isn't just for talking to the patient. Within that tiny window, a physician has to review your history, perform a physical exam, make a diagnosis, prescribe medication, coordinate care for complex conditions, and somehow complete all that burdensome documentation we just talked about. It is an absolutely impossible ask.
And here is the genuinely terrifying consequence of that rushed 32-minute data entry reality. Because primary care, which is supposed to be the absolute backbone of a healthy society, is so completely overburdened and unsupported, 12 million Americans are affected by diagnostic errors in outpatient settings every single year. When you force a doctor to be a typist on a ticking clock, human beings slip through the cracks and critical diagnoses get missed.
Which brings us to a critical turning point. The authors of our source material make a definitive, line-in-the-sand statement: the time to patch a broken system is over. It is time to replace it entirely. We simply cannot incrementally fix an architecture that was explicitly designed to extract profit rather than provide care. We need a completely new foundation from the ground up.
The XHealth Blueprint, a radical replacement.
So the XHealth Blueprint rests on 3 absolutely core pillars.
First, safely expanding primary care, making it the true, robust first line of defense it was always meant to be. Second, utilizing agentic AI. And by that, we mean AI that doesn't just chat with you, but actively takes action to build a real clinical intelligence layer. And third, shifting acute recovery out of expensive, sterile hospital beds and directly into the home using advanced remote telemetry. The goal here isn't to replace the physician with technology, not at all. It is to use clinical intelligence to empower them, giving them the tools to see more, know more, and do more.
How does this actually build a better reality for the doctor-patient relationship? Let's break down the time shift. By separating clinical judgment from corporate profits, and by utilizing that AI intelligence layer to capture a comprehensive patient history before the doctor even walks into the room, the total time spent documenting just plummets. The encounter streamlines to 24 highly effective minutes. It gives doctors a massive reclamation of their time to actually diagnose, treat, and truly listen to the patient sitting right in front of them.
So how exactly does this magic work behind the scenes? Well, it brings intelligence to where it matters most, the point of care. Step 1 is clinical decision support. The system uses AI-mapped diagnostic pathways to provide real-time guidance. Step 2 is ensuring all of this is evidence-based, firmly grounded in interoperable clinical standards like SNOMED CT and ICD-10. Think of those as the universal coding languages of modern medicine. Every single recommendation is traceable directly to clinical literature, which massively reduces the doctor's cognitive load. And step 3, streamlined workflows. Fewer clicks, less administrative overhead, allowing physicians to just get back to what they actually trained for.
All of this builds to the uncompromising dual promise of the XHealth platform. It's a bold mission statement, but here it is. Achieve a 50% cost reduction across the system, while simultaneously delivering a 2x increase in the quality of care. Now, I know that sounds completely impossible under the legacy model we're used to, but when you eliminate that 30% waste we talked about, and you cut out the massive administrative bloat of the medical industrial complex, this actually becomes a mathematical reality.
And the best part, all of these concepts, all of this data, and this entire roadmap have just been released to the public. Today marks the launch of a highly anticipated new manifesto by pioneer medical informaticist Dr. Stephen C. Lloyd, who is drawing on 5 decades of frontline clinical experience, by the way, and clinical informatics researcher Manasa Devi Chinta. They have taken this methodology and codified it into an urgent empirical blueprint for the future of our survival.
This whole vision is now fully laid out in XHealth, the operating system for American vitality, which is available right now on Amazon Kindle and in paperback. It's a blueprint that perfectly bridges advanced data architectures with human health, and it carries a singular, unapologetic mission: double the quality, half the cost, and the end of the medical industrial complex. This isn't just a book to read and put on a shelf, it's a completely actionable guide to reclaiming our healthcare.
Which leaves us with just one final question to wrap up this explainer. Now that you see exactly how the machinery works behind the scenes, and now that you know a first principles alternative actually exists out there, will you remain a passive profit center for the medical industrial complex, or will you read this blueprint, join the movement, and help reclaim American vitality? The choice is now yours.